Ray. We have Will, who's calling in from Texas. Will, you are live on Truth Wanted. What's up?
Hi, thank you so much for taking my call. I appreciate the jokes earlier tonight, and I wanted to call in and ask largely Dr. Ray, but of course, if you have any thoughts, Dan, I would appreciate them too. What are the most common signs of religious trauma? And then I have a couple of follow-up questions after that.
Well, it varies quite a bit, and there's some controversy about whether we call it a syndrome or not. I think ultimately we may get there, but right now the main things we're looking for is, people are having trouble sleeping as a result of something like religious abuse when they were young, fear of hell, fear of Armageddon, those kind of things that people perseverate and they can't get out of their head. And it affects their ability to work. It affects their ability to have normal relationships. Another thing is sexual difficulties, sexual function that is related to religion. For example, an adult person who as a child was spanked or beaten because they were caught by their parents masturbating or something like that. That can really cause sexual trauma that manifests itself later in adulthood. There's quite a few different things that we look for like that. But the thing is, all we have to do as psychologists these days is look at the DSM and identify what are trauma symptoms. If we're seeing those symptoms, that some of the things I named, if you trace those back to religion, then we can call it religious trauma. If you trace it back to watching an IED kill your buddies in Afghanistan, that's war trauma. There's lots of things that cause trauma. Religion's one of them. So we're not trying to say religion causes all trauma. There's a lot of other things. So
we're just kind of identifying the source of that particular trauma.
Yes, but knowing the source can help with the treatment. Because if you're a therapist and you're trained in PTSD, great. But what if you're still a Christian and your own things, you haven't dealt with your own shit, and you give off things that would trigger this person? Maybe you've got a Bible or maybe you wear a cross. I mean, those are the kinds of things that can undermine a therapeutic relationship, and the therapist doesn't even know it. That's why it's so important to keep religion out of your therapy practice. Keep the Bibles out, keep the Quran out. Don't wear a cross, don't do that stuff, because people are coming to you for help and they may be traumatized. What if that person was, for example, a 14-year-old girl, 15-year-old girl brought in front of the Baptist congregation and forced to confess that she had sex with her boyfriend? Of course, they didn't bring the boyfriend up there. Well, now as an adult, 15, 20 years later, she cannot function in her marriage. And so they're having marital problems. Well, okay, you could go to a couples therapist and the therapist would say, I can help you. But if you don't understand where that came from, help that person understand the trauma that was caused by being shamed in front of the entire congregation. I mean, I can't even get my head around that. I have heard this story way too many times, especially in fundamentalist Baptist churches. So I don't know. Well, I can go on and on, as you probably know. So that's my short answer.
Yeah, and I know you asked me for an answer too, but honestly, Dr. Ray just gave a better one than I could have ever said. So I'm gonna leave it to that. But Will, did you have a follow-up question too you wanted to ask?
Sure, I appreciate the response. I really appreciated what you said, Dr. Ray, about these different ways that trauma can be caused, and it's a good thing to remember. People that have been gaslit by Christianity in general, into believing it, and I'm just making a broad statement here, seem unable to draw parallels between abusive behavior and the Christian God, at least from my attempts at it. What's a better way to help a person see these issues?
Well, I just as I mentioned earlier, I just did a tour of all of Australia talking about religious trauma and your brain. And that's the very thing I was talking about through this talk. And I've given it I will be giving it some other places. But my short answer would be, if when it comes out on YouTube, watch it. It'll give you some answers to your question. But the problem is that when you are being indoctrinated with a given religion at 4 years old, at 5 years old, early childhood, you do not have the critical thinking skills to ask your parents, why are you raising me Mormon? Why not raise me Buddhist or Catholic or something else? It's the same as for language. You're probably raised, if you're raised in Texas, you're raised with an English or Spanish around you, and you didn't ask your parents, why aren't you teaching me Chinese? Why aren't you teaching me German? That never occurs to a child, any more than it occurs to a child to say, why this religion, why not others? When a child is indoctrinated with something that early in life, their brain it literally wires the brain that way. And then there's other messages that come in with that indoctrination, like fear of hell, fear of abandonment, fear of shunning, fear of Armageddon, whatever your particular religion's fear aspect is, that's getting wired in as well. Fast forward 10 years, when you're starting to get some critical thinking skills, that wiring is still there. You are still a 5-year-old indoctrinated child. And that's why we see adults that are 30, 40, 50 years old that are atheists. I've been an atheist for 20 years, people tell me, and I still wake up with cold sweats for fear of hell. Well, that's clear evidence that something was brainwashed, programmed into you at a very early age. And it takes some sophisticated treatment to help you move through that. I'm going to suggest, if it's something you're having trouble getting over, you should get some help with a trained therapist who understands or can work with religious trauma. And if they don't know what religious trauma is, which many therapists don't, then there's many therapists that are good at trauma treatment. But when you talk to them, when you go in to talk to them, explain what you experienced and it was caused by religion, and you want to make sure that piece of it is explored. And you'll probably get some good treatment, because the treatment for trauma is not the same, but it's very close to the same in many aspects of whatever the etiology, the cause of the trauma. I'm not saying they're identical, and a person would be well informed. A therapist should be well informed about different kinds of trauma.
Sure.
So find a therapist that's evidence-based, licensed, and secular. That's why we started the Secular Therapy Project. But you are, I don't know if you're speaking for yourself. It sounds like you may be. Are you?
In some ways, I definitely, like, many people in Texas grew up religious, Christianity specifically. And, even though I've been out of it for 8 years now, I still have a hard time. Like, I can look at it intellectually at the concepts that are part of Christianity, the basic concepts that everyone shares, and say, this doesn't make sense, this is abusive, etc. But I don't feel that. And so, largely speaking, I have the angry atheist kind of thing going on to a wide extent, but, I try to temper it. But certainly, and I do have, thankfully, a secular therapist who has been very helpful in going through these things, and I highly recommend that for everyone that is able to do so. Thank you very much for your responses. That's all I have.
Sure.
Great. Thank you, Will. Thank you so much for calling on that and being open about that as well. I can speak. I've actually gone back and forth on this show of whether I said I've ever experienced religious trauma. I realize now, in retrospect, the symptoms that I had displayed at the time, I think, match up with the criteria of religious trauma. I think I've thankfully pretty much completely recovered from that. But I did have nightmares about going to hell, and I did wake up in cold sweats, and I did have issues that, you know what, I'll be honest, affected my sexual dysfunction because I thought I was like sinning because I was, you know, interested in like dating women and stuff and wanting to do the kinds of stuff that normal people my age did, but I was taught was wrong to have those thoughts. And that's a shitty thing. That's a shitty thing I had to go through, and I don't wish it on anybody. And I cannot imagine experiencing those symptoms today and continuing to have those. Yeah, if you do feel like you have those things, please go find somebody that you can talk to about it. You know, that's what I would say. But no, I appreciate Will calling in.
I want to say
asking,
one more thing, if Will's listening, hopefully, is
Mm-hmm.
that our brains are pretty complex. But
Yeah.
to simplify this, you've got two parts of your brain. You got the logical part and the emotional part. And the emotional part, the amygdala, and the logical part of the brain does not form until much later. I mean, you're in your late teens before the prefrontal cortex is starting to mature. So all the time until you're 14 or 15, your brain is very susceptible to these programming and this fear-based kinds of training. So that's why you need help, because you usually can't logic your way out of this, because it's not a logical problem. It's an emotional problem.
Can I ask you a question? You know, I'm going to do some announcements in a second here, but I want to know this for you, Dr. Wright, because you used the term earlier and you used the word brainwashing. Now, I've heard in the psychology community that word is kind of a controversial word to use because there's been different.
I should probably. I mean, I'm a child of my own age, right?
Sure. Well, please.
Bad. It's probably a bad concept.
Okay.
But most people know exactly what I'm saying when I say it.
Sure.
There's been some indoctrination. It would be better to use the word indoctrination.
Yeah. Well, I guess I've read about this. You know, the people trying these like anti-brainwashing kind of therapies and stuff, but like they're not really. I don't know. I've read the effectiveness is questionable on some of the actual techniques. So like, you know, what you're advocating for, I don't think is that kind of therapy.
No.
No.
Thanks for calling me out on that.
Oh, no,
I stand corrected. You're right. You're absolutely right. It slips out of my mouth.
No. I totally understand that. It's just something like, as soon as I heard, when I first discovered that was a very particular object of study within the literature, I thought that was interesting because you hear brainwashing in the common vernacular, and then you hear it like as when it's tried to been used as an academic term, it hasn't.
Yeah, it shouldn't come out of the mouth of a reasonable psychologist.
No, I'm not trying to call you out. I'm not trying to. I was just asking for.
However, if your audience is interested in reading about the origins of what this all is, there's a great book you can get at the library probably called "Battle for the Mind." It's written by a man named William Sargent in 1957. He was hired literally by the U.S. government to study this. He's a psychiatrist, to study how how Korea and China were getting American soldiers to confess. How were they changing their minds so dramatically and getting them to say things that everybody knew they didn't really believe. So
interesting.
This book is really interesting. And here's why I bring this up.
Okay.
He starts out by showing how Charles and John Wesley did their English revivals and how they used these mind-changing and mind-stimulating and fear-mongering kinds of techniques. So he starts off with the Methodist Church and shows how the Methodist Church was founded on these techniques. And then he moves on into very interesting psychology. It's an old book. You've got to kind of overlook the 1950s medical terminology, but the basis for it is phenomenal. It opened my eyes to so much. It's one of the most impactful books I've read.
That's very interesting.
Yeah.
That you said Wesley, and the old Methodist in me, like, you know, like just did a little jump.
Charles Wesley was a hypnotist par excellence. He could get 1,000 people in a tent rolling in the aisles. And remember, this was before there was amplification and microphones. This is in the mid 1700s.
Yeah.
Pretty radical kinds of abilities that he had.